Hello everyone and welcome to today's webinar, Safely Navigating the Industry Recovery, Occupational Health and Safety in the Context of COVID. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You may have joined the presentation listening using your computer speaker system by default. If you'd prefer to join over the telephone, just select phone call in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. It is my pleasure to introduce you to Ruby Sayed, Head of ATM Advocacy for IATA, to kickstart the proceedings. Ruby, I hand it over to you.
Thank you very much, Helen, and good morning, good afternoon, and good evening, depending on where you're joining us from which time zone. And welcome to today's webinar. We have great speakers who will be joining us today and talking about their perspectives on the impacts of health measures on operational staff and other issues and challenges we might be facing in an operational context, such as the long-term impacts of COVID infections or the potential long-term impacts. They will also share best practices about the return to work policies, and you can find that on the slide, on the next slide with the webinar synopsis. So you can find a brief description about the webinar we have today and the panel discussion. But before we get into the panel discussion, we want to give you the context of why we are organizing this webinar series and why it's important to look at some of these challenges in the new operating environment. And with that, I would like to welcome our two speakers who will set the scene for us, not just for this webinar today, but for the whole series. And with that, I would like to welcome Michelle Bishop, who is responsible for the management and oversight of Cancer's global safety, operational, and strategy programs. Welcome, Michelle. And also, I would like to welcome Carlos Cirillo. I work with Carlos, actually, and in addition to leading IATA's work on ATM infrastructure and technology, he's also leading the work related to the restart and recovery of the aviation supply chain. And they will both share with us the current state of the industry, what we can anticipate over the next few months, and why it's an underlying priority for us to look at some of these challenges that we will cover today. And with that, Michelle and Carlos, over to you.
Thank you, Ruby. Nice to be with you again, Carlos.
Yes, like Groundhog Day.
It is like Groundhog Day. Helen, can you go to the next slide? This was a series that we came together with IFALPA and IFATCA to do a year ago, almost a year ago to the week. We started this 5-part webinar series last year that ran between April and August. These are the topics that we considered last year when we really wanted to talk about the safety issues that were unique to the pandemic crisis we were all in. It was a great series, very well attended, large audiences for all of them. And we couldn't have known in April 2020 that this was going to go as long as it has. I feel like we were young and naive in some ways when we came together the last time.
Definitely.
Yeah.
I think when we start discussing this, and we had the expectation, at least I did have that expectation that by the end of last year we'll be back and flying again, and business as usual. But it proven it to be totally wrong.
Absolutely. And I think one of the reasons we came together to repeat this series again is the time that this has gone on affects those risks, certainly, especially ones like competency. And we wanted the opportunity to revisit all of these and to talk about those issues about how some of the risks may be affected by the length of time as well that this has gone on. But let's go, before we get into it, with a bit of the larger context of what that last year has looked like. Helen, do you want to go next slide? Thank you. We're still a year on from when we were last together on this. RPK remains significantly down, suggesting that a lot of the planes that are flying with very low load factors. The number of global daily flights, even when we add in, you know, VFR and cargo and military aircraft, global daily flight numbers are still down 40% off normal averages. We're seeing in some areas lockdowns and restrictions being reimposed as countries are experiencing second and even third waves, and continuously evolving testing and quarantine requirements are certainly in some areas affecting the public's willingness to travel, even where they can, because the changes are happening so much. But there's a vaccine coming and we're getting shots in arms, and there is some reason for optimism and a need to be prepared for the safe recovery of traffic when it comes. Next slide, Ellen. Helen, next slide. There. This is what the last year's looked like from a global flights number. At the left, you see the average number of flights operating. We were in February 2020 down 1 million flights over the month from what we would normally see. Global flight hours down 36%, 2.2 million fewer flight hours. So you see clearly on that chart where we were last April when we had our first one of these sessions, and that slow climb out of the basement that we have been experiencing, but with traffic largely level, that's still a fairly low level since midsummer. Next slide. Regionally, the pictures looked similar. Some real similarities. Everyone has been significantly impacted, but there's been some interesting differences. The pink line is an obvious one showing Europe, which had a bit of a climb out in the August time period, only to fall back quite significantly. The orange line showing North America is an interesting one. Certainly actions in the United States in particular have kept traffic from falling quite to the level that it has in some other countries. You can see the early drop in Asia in the sort of January, February 2020 timeframe where things fell off. And, you know, domestic numbers in Asia are still looking quite encouraging. So, but still the loss of that international connectivity has kept their numbers quite off of what we would see normally. I think in this chart, Europe and the North Atlantic are sort of tying for the most heavily impacted. Certainly, intercontinental flights on the North Atlantic are certainly still quite depressed. So you see how the year has played out regionally. Certainly heavy impacts across all the regions, but some interesting differences to see in the timing of when lockdown restrictions have hindered traffic in other regions. Next slide.
And then if you can see this slide that we are focusing mostly on international travel, and there's a correlation between what Michelle was saying with domestic and international. While we see Asia Pacific really very steady and practically the number of traffic, especially in China, being the same. But when you go to international, it's totally different. And it's totally related to how the country is in terms of the border and the measures, quarantine, and so on. And you see here in the slide that this is directly the impact in the way we can fly international. And let's say inconsistent and different measures being applied every day. It's very difficult to plan today. Airlines have, I would say that the window in terms of what they can see for planning is less than 30 days, which is very challenging for everyone in the industry, for airlines, for air navigation service providers, airports, the whole supply chain, because everyone has to prepare, and it's very challenging these days. Next slide, please. But as Michelle said, there is a light, and we can see the light coming. There is a notion that people really want to go back and fly. And we see this is an example that happened last year when the UK announced that the UAE was exempted from the quarantine rules. We can see the spike in traffic, and that's great, but it's bad at the same time. Because if you see the time that was between the when the was exempted for the quarantine, when the traffic spike, it's pretty high, the peak. And this is going to be a direct impact in everyone. You can expect as a controller that we are controlling X amount of flights for almost a year, and suddenly everything changes and you have to adapt. And that's why one of the reasons why we are focusing again on this series of webinars, because we need to be prepared. And we know that everyone that is operational has been under a screen or flying, how difficult it is to adapt to a totally different scenario. Next one, please. This is just to show we recently did a survey on the passenger side, and you can see the difference between when we started the survey last year and how the people will be changing the way they are perceiving flying again. And now with the vaccines and people get more used to this normal life, there is a urgent to go back and travel, and it's not like as was like a few months ago that people were like waiting to travel. That people are willing to go and travel. You see the 57% wants to travel as soon as we have release and then the borders and all the measures are taken. So we can expect that will be a surge in travel. So we need to be prepared. We need to start looking to all the recent currency of all the skilled workforce to make sure that we are ready to safely restart.
I'm really encouraged by those numbers. It's nice to see that trend line towards more people thinking that as soon as this ends, they're going to get out there and travel. I certainly count myself amongst their numbers. You too, sure. I'm sure. But it really does, you know, you're pleased to see the numbers, and then my mind immediately goes to the challenge of that, to the issues we have to be ready for, to the, you know, the active preparedness to manage those safety risks of taking a system that has been at a depressed level for so long and potentially seeing a fairly rapid increase. Maybe not back to 2019 levels, but even if you know it's a significant bump from what we've seen, it's something that we absolutely need to be ready for.
Yeah, fully agree.
Yep. Ruby, back to you to get us started into today's topic in this series.
Thank you, Michelle and Carlos. And everything you said is actually the reason behind this joint initiative, which you can see some of the details on the next slide, between IATA, CANSO, IFALPA, and IFATCA. As we look at these elements, whether it's the prolonged periods of low traffic, the potential spikes in traffic after this, you know, long periods of no traffic, and then the different elements that not only impact travelers, but also impact, for example, crew, whether it's quarantine, different requirements as you travel into different regions, the impact on international traffic and international flights, how that impacts recency and recent experience, in addition to other impacts that the pandemic had on different stakeholders in the supply chain, particularly on the workforce. So all of these elements are actually motivating us to look at the risks associated and challenges. So we're doing a joint safety risk assessment where we look at all these elements. We try to assess the impacts, how far it can be of an issue, and through the webinars we are engaging the community, the wider community beyond the partner organizations, in order to get insights and views on what additional best practices we can make available, tools that we can make available, and resources to ensure a safe restart and recovery, hopefully going back to normal traffic levels. I certainly cannot wait to book my next flight. And I was actually also very naive maybe last year, because I thought it was just 6 months and then it's we'll provide all the webinars and then we'll go back to normal. So we're still navigating this new risk landscape, and with the presentations today and throughout the webinars, we will provide more insights on how to navigate the risk landscape and how to make sure that we go back not only better but also safely and efficiently. So with that, I would like to welcome our moderator for the panel discussion today, who will walk us through all the presentations, but also who will help us with the Q&A and conversation amongst the panelists. Jean-François Lepage is our moderator for the panel discussion related to occupational health and safety. He will, through the discussion and conversation with the panelists, cover a lot of the elements related to back to work policies, in different health measures, how they impact operational staff, especially crew, and what can we do in order to make sure that we remain safe with all these elements. He's also our partner working with us on this joint initiative for the safety risk assessment, so we rely on his insights a lot when we work through the SRA and also even the bulletins and the resources that we provide after the webinar. So Jean-François, over to you, and thank you for joining us.
Thank you very much, Ruby. Good day, ladies and gentlemen. Just a few words to introduce myself. I'm an air traffic controller here in Montreal for NAV Canada. I work en route at the Montreal ACC, and I'm also the liaison officer for IFATCA on the ICAO Air Navigation Commission. I would like to take this opportunity to thank IATA for doing me the honor of moderating this webinar today on the topic of occupational health and safety in the context of COVID. As Ruby mentioned, this is the first webinar of our 2021 series of joint webinar with CANSO, IFALPA, and IATA related to safely navigating the industry recovery. Some of you may have attended last year one or more of our webinars, but today we have some new topics, completely new topics, and some of the topics are revisited because of the evolving context. For this specific iteration on occupational health and safety, we found that there was a need to examine the impact of varying health requirements on operational staff and the management of human resources. We wanted to get an idea also of what operational staff and managers should keep in mind when it comes to COVID infection and possible long-term impacts. We wanted to highlight the importance of return to work policy developed in the context of COVID, and finally identified what are the impacts of complexity and variations in health requirements, especially for flight crews. So let me just say on behalf of all of us that CANSO, IFATCA, IFALPA, and IATA, we're very excited to organize these webinars, and we hope that you will enjoy the following 90 minutes spent with us. In this first episode, you'll get to hear from 3 experts from IFALPA, from ICAO, and from the FAA in the United States, who will discuss a number of factors affecting the ability of operational staff either to continue operations or in some cases to go back to normal working environments. So at this point, I would like to introduce briefly our 3 speakers today. Our first speaker is Dr. Ansa Jordan. She's the Chief Aviation Medicine Section in ICAO here at the headquarters in Montreal. Our second speaker today will be Dr. and Captain Antti Tuori, airline pilot for Finnair, a medical doctor and aeromedical examiner for EASA. He is here on behalf of IFALPA. And last but not least, Dr. Susan Northrop from the FAA. She's the Federal Air Surgeon at the FAA in the United States. So just before we move to our speakers, I would like to hear from you, our participants. Would like to take a few moments to ask you a few questions just in order to get a feel of who you are, where you live, and which sector of our industry you represent. So the first question we would like you to answer is which part of the industry you're from, whether it is the airline, airport, ANSPs, academia, or others. So we'll give you a few seconds to answer that. Thank you very much. So the results are shown on your screen now. We can see that we have a good representation from the airline and the NSPs, which is good. Our second question is regarding your geographical area. So we would like to know from you where you are based, from which region, whether it's Asia Pacific, Africa, Middle East, Europe, North or South America. Again, we'll give you a few seconds to answer. Thank you very much. So very good representation today, mainly from Europe. It's the middle of the day there. North America is still waking up maybe a little bit. Thank you very much, everybody. So without further ado, we will move to our first speaker today, Dr. Ansa Jordan, representing ICAO. Dr. Jordan, thank you for being with us this morning, and the floor is yours.
Good morning, Jean-Francois, and good morning from Montreal. And thank you very much for the invitation. I'm looking forward to sharing with you what we have been doing. I'm not looking forward to sharing all the obstacles we have, but then again, we have some solutions that we're trying to address those. And previous speakers said that they were a bit naive. I think all of us thought we would be back soon, and it seems that it will still continue for quite a while, at least until the end of this year. And it's not that we underestimated the virus is just keeping changing all the time, and we're trying to keep up with that. So can I have the next slide, please? So quickly, we'll give you a snapshot in time of where ICAO is at the moment in managing the COVID, and then some aspects on aviation certification and personnel per se, a little bit more about communication, and then some of the challenge we're facing going back to normal. Next slide. So what have ICAO been doing? Shortly after the pandemic started, the council formed the Council Aviation Recovery Task Force. We had 3 phases or 3 sessions of the council since then. The last one was last week when so one session or one council card session lasts for two months easily. But our last session ended last week, and we published new protocols and new reports. So to date, we have had 3 reports. There's 10 key principles, 20 recommendations, and they all have to do in various aspects of the aviation environment. Going a little bit deeper than that, we have the takeoff guidance document that provides more detail on the public health measures, a little bit more on health, like the mental health, the hazardous waste. And then still going a bit deeper, we're getting the technical document, which is the Testing and Cross-Border Risk Management Manual. 2nd edition has been published. It's just being finalized by the editorial team. And you can see there all the chapters that's included in that manual, and it has been updated from the previous one, and we're already working on the 3rd one. And last but not least, we have the Public Health Corridor, IPAC. IPAC is an implementation package where we put together everything that a state might need to help them implement a public health corridor, which really opens routes between states, between airports, and it's based on a bilateral discussion between the different states. And this is where the objectives is very clear. What we're trying to achieve is to continue flight operations with as minimal disruptions as we can, to mitigate spread of COVID-19 while in the air, but also translocating it from one area to another, and at the same time protect the health and safety of both the crew and the passengers. So next slide, please. Now, if we look at medical certification, medical operations in aviation, a lot of aeromedical examiners has not been able to do examinations as normal because they were redirected to actually apply medical services because of COVID. We also had problems due to the restrictions in public health to have access to medical examiners that are available, especially where we have crew that is licensed in one state and needed to travel to another state to renew their licenses. So we had to come up with a solution for that, which was alleviations, and then that in the meantime now has transformed into targeted exemptions. And the additional factors that is really affecting crew now is testing, the vaccination, and then we're also looking at the long-term effects, which I will discuss in the next slides. So the next slide, please. So alleviations in the beginning, we tried to extend the validity of the medical certificates because they couldn't have access. Those were all based on a risk-based approach, type of license, type of medical condition, if they had to submit follow-up reports to maintain their licensing. All of these were taken into consideration, and we had a guide for states how to apply that. States needed to report that, and then they could say whether they accept those mitigations. Now, that was in place or is in place still until the end of this month. But our concern is growing about the safety of the operations and also the health status of crew, especially if you had an extension of your license for a year, for example. So we are concerned about the recency, the proficiency, and also the medical status of crew. So we have now, with the council, have decided to replace that system by targeted exemption system, which is a bit more focused, lower scope. And again, we have compiled guidance to the states. So the medical certification group met yesterday. We have finalized the template. And one of these mitigation measures, for example, that we discussed is we prefer face-to-face examination, and we are urging states to return to face-to-face examination as soon as possible. But in cases where it is not possible, we do suggest alternatives like limited physical examinations, telemedicine, the use of health certificates. But all of these has certain limitations. There are certain caveats, and those is what we are communicating to the states and what the states need to communicate to the license holders. One important part of recommendation 12 that I have not mentioned there is that we also encourage states to facilitate access of crew. So have them in the public health corridor concept so that they can travel easily between states to get their medical licensing done, to get their training done, and to prepare for when we resume normal travel. Okay, the next slide, please. COVID-19 testing. It is a lot that is happening at the moment. So in the beginning, when we did the manual in the previous round of the card, we recommended for states to implement testing. And if they're going to implement testing, to implement it in the way that we have outlined it in the manual. So testing per se, there is various tests. You have antigen tests, you have antibody tests. There's various times to apply it to get the best result for the application that you're using it. So initially it was just to prevent the transmission of disease. Now we're also looking at using testing for genomic sequencing, that we know where these different variations is coming from. Recent studies also show us that although the number of people that has had COVID is underestimated if we look at the testings that were done. So the initial tests to diagnose COVID that was positive is much lower than what the antibody testing is showing us now of people who have had COVID. So that's just one of the intricacies of these tests. We have other problems where a test might be false negative or it might be false positive. And there needs to be some measures to deal with that. And that is all included in our manual. The other problem that we had is flight crew, for example, flying, crossing various borders in a day, and every time they're subjected to testing. So in the manual this time, we differentiated between pilots and crew traveling for duty purposes and passengers. So we are trying to encourage states to exempt crew from testing. If they cannot exempt crew from testing because of national guidelines, we then request them to minimize the number of tests, maybe before they leave for the flight and when they come back to their home base, and that these tests should be as minimally invasive as possible. And the other problem we have in general is when a test is done and airline staff need to confirm that a test has been done for passengers, you get different test results on different types of certificates. And we are trying to standardize those certificates. And we are also issuing guidance on how to ensure that these certificates are secure, because we have had instances of fraudulent passenger testing certificates being presented. So these has all been addressed in the latest round of CARD. Next slide, please. So vaccination has become the holy grail for people, thinking, oh, if I'm vaccinated, I'm okay. And you are okay if you're vaccinated to a degree. So certain vaccines are effective against certain mutations. Some are more effective against certain mutations than others. The main protective effect that we have at the moment is that it protects the individual against getting severe illness, being hospitalized or dying because of COVID-19. In some instances, there's more and more reports coming that saying that vaccination could also protect you from getting infected or from getting symptomatic infection. What we don't have at the moment is conclusive evidence that once you have been vaccinated, that you are no longer able to transmit the virus. And this is really important. So you might have your vaccination, but you might still be able to you might have had the virus, or you might have the virus now. You might be vaccinated, and you can still travel and transmit the disease. In the studies that has been done in air travel, the likelihood of being infected on an aircraft is really much lower than other areas because of the HEPA filters, because of the way we do the distancing and the need to wear masks. But once we have a higher population that is vaccinated, then we will also be moving towards more protection. And I'm sure you've heard about herd immunity, where other people will then be protected against infection. The problem for us now is to get as many people vaccinated as quickly as possible, because that area where persons are not vaccinated and where a new variant might spread is where we have the concerns, because if the virus mutates in between, it might become more infective, and we saw that with some of the variants that came out from South Africa, for example, was much more infective than the first COVID virus. So really, vaccination is very important. And what we are saying in terms of the crew is we're encouraging states to get their vaccines as soon as possible. They also have to comply with the national guidelines, and the national states has to comply with the WHO guidelines. So you will see there that aviation workers are included in stage 3 of the recommendations by WHO, which means that there should be vaccines available, and that between 21 and 50% of national population should have been vaccinated. Now, we know there's problems with rollout of vaccines globally, but we also know that some of our airlines have vaccinated all of their crew already. So it's really up to the national policies how they go about that. When crew has been vaccinated, or if a state is considering vaccinated crew, we're providing some guidance for them in terms of vaccines to use, whether they should be grounded post-vaccination. We're not recommending it as a blanket. It should all be based on a risk assessment. If you have side effects after vaccination, you might have to be grounded, or you might not have to work if you're a controller. But that is really dependent on an individual risk assessment. The other problem, WHO at the moment does not recommend vaccination, and the reason for that is because we are not sure about the transmission. So they are working on this. Should WHO really mandate vaccination for everybody, they will be requiring evidence of that vaccination, and that could be on the yellow fever card, that form that all of you know. Or it might not be. We are really looking more towards digital vaccination certificates because of various reasons. So we're waiting to see what will be happening in that aspect, and we expect WHO to come up with a recommendation on that in May. In the meantime, we are requesting states to issue evidence of vaccination for anybody that they have vaccinated, and that it should be at the moment in accordance with their national regulations. Because what we are seeing, there are some states that are exempting passengers if they've been vaccinated. They let them into the country without having to do additional quarantine. So really everything is in flux at the moment. Next slide, please. In terms of long-term effects for crew, the most important one is actually the one on the bottom. I should have moved them around. Is the effect on mental health and well-being. I don't think there's anybody who has not been affected by COVID in whichever way, whether it's financial, whether it's death of a loved one. It's just the isolation that we're dealing with. There's a lot of psychological effects and a lot of depression that is going in hand with that. So ICAO has published an electronic bulletin where we are focusing the attention of states and airlines and the stakeholders on the possible effects of COVID-19 on our crew. And then we're also asking them to provide support to aviation personnel. So in the picture on the right, you can see everything that we are issuing guidance and who we are issuing guidance to in terms of mental health and well-being, with a strong aspect on peer support. And really, this is an abnormal situation. What we're experiencing is normal due to the abnormal situation. So we are very hesitant that states will start looking at employing depression protocols or extra protocols that is not necessary. And that brings me to the second point on fitness to fly. Except for the depression or the psychiatric protocols, we know that there's something that's now termed as the long haul COVID syndrome, where you have extreme fatigue, brain fog is how they refer to it. You have troubles getting back to normal operation, normal walking, normal activities in a quick time. It can last up to 6 months. So we will need to be looking at those protocols if crew has had COVID. Sometimes they don't even know that they've had it, but they already have a restriction in lung function. But again, we do not want to go overboard and just implement protocols everywhere. So we are really looking at this to see how to do that so that we maintain safety, but that we do not implement things that are not necessary. Okay, next slide, please. In terms of not knowing what's happening, so there's lots of testing happening at the moment. About 80% of states require pre-departure testing, about 50% testing on arrival. The number of days of quarantine varies from state to state. The number of tests, the type of tests, all of that varies. So we did a survey, and on the one hand, we asked whether there's internal collaboration, and you can see there at the bottom, it's only 1 or 2 CAAs that determined their strategy in accordance with not collaborating with Department of Health or Transport. So we are going to really focus on this going forward. We did that already, but we need to do some more work on this to have this communication within a department. And then the next slide. And the most important one is the information sharing between states. And we can see here that most of them is sharing it internally on the implementation website on ICAO, but then also through NOTAMs and the regional offices and representatives, diplomatic representatives. So we have been working on the IPAC, which helps states to implement public health corridors. And during this survey, we could see that about 50-50 has looked at it or is working on it, and 50% has not implemented it yet. So in our IPAC, we are publishing, there's a lot of tools, checklists that has been published on the website, but we will also go to states. We will have subject matter experts who will engage with states and help them to restart aviation. And there's also a template on the ICAO website that can assist states with that. Okay, next slide. This is the last slide, and it's just to give you some idea of the problems we have and how we go about that. So communication, just discussed that. We are taking into account all the problems states have with implementing recommendations. And there's also a high-level COVID conference, which will be held later this year in ICAO to determine the problems determined by state and how to address them. We discussed the differentiation between passengers and crew. For me, the most important problem we really have is the dynamic changing environment. COVID, the virus changed and keeps on changing. And that means we need to keep on determining whether the tests we are using is still accurate, whether the vaccines are still accurate. Do we need to have booster vaccines? So it's very important for us to constantly review the science and to constantly update it in terms of that reviews. The testing complexities, discussed a little bit of that. One of the problems, for example, we have is someone who has had COVID and then do a test and might test positive for COVID, but they have already recovered and they are not infectious. So we are trying to address that as well in the manual by requiring confirmatory tests if it looks clinically that someone is ill or if there's symptoms. And if they're using an antigen test, which is less accurate in certain cases, then to confirm that with a PCR, which will not always work because they might have had a PCR already, which would show positive. So there's some of these that we are trying to address, and as the science develops, we'll be able to address these better. The one important thing that I did not mention is that we don't think that vaccination should be mandatory for crew. It's up to the crew member to decide whether he wants to have vaccines or not, or the aviation or frontline worker. So we're advocating for crew and for frontline workers and any critical safety positions to really be vaccinated. But it's still an individual decision, but it is up to the state and to the airline or the airport or the service provider to make these information available to them and to facilitate their access to that. In quarantine, WHO is working on that. States not implementing quarantine in accordance with WHO guidance. So that's also being addressed. Standardization we spoke about. And then the last, but the most important part is the lifting of restrictions. So if we implement more public health corridors and we have more best practice, we can learn from the best practices, and we also have more data on how it is working. For example, there was a study done in Toronto, passengers arriving at Toronto airport, they did PCR tests, and that data that we obtained there shows us that we can safely decrease quarantine from 14 days to 7 days, for example. So it's really important that we get on the ground information and on the ground data, and that we start lifting these restrictions as it's no longer necessary. And again, that is monitoring what's happening, updating it in accordance with science, but also taking into account the importance of aviation and the role we play in managing this pandemic, in providing services and keeping economies going, because there shouldn't be a dichotomy between health and economy. The two goes hand in hand. And that is my last slide. Thank you very much.
Thank you very much, Dr. Jordan. It seems that your job is secure for the next couple of months, at least, maybe a couple of years. A lot of interesting questions. I guess you're very busy at ICAO working on all these. Thank you for your presentation. We'll come back to you a little bit later with the Q&A when we get there. But before that, we'll move to our second speaker, Dr. and Captain Antti Tuori from Finnair and representing IFALPA. Dr. Tuori, please, the floor is yours.
Thank you, Jean-Francois, and thank you, Ansa, for the very good presentation. So I'll be talking more of crew perspective, especially from pilot's perspective, and actually what is going on and what the procedure right now are when we're looking them through the pilot's eyes. I'll concentrate on the room lockdown or quarantine, then some testing. Use of face masks is one thing that is really affecting pilots while they are on duty. And then, of course, a couple of words of vaccination. Next slide, please. So this is the scene of, well, the ultimate quarantine or lockdown, what is actually happening right now in some of the destinations where we are flying to. So once you get to the airport, you are escorted to the hotel room, or then it's the quarantine facility. And the people who are escorting you, they have these space suits, and you are treated as if you would be very infectious all the time. And you are actually escorted all the way to the room, and the room is then, well, the door is shut. It's not locked from the outside, but you are not allowed to leave the room unless there is a some sort of medical emergency, but otherwise you have to stay inside. The food is delivered outside of the room. Quite often they just knock on your door, you have to wait a couple of minutes, and then you open up the door and pick up the food that is left there, and you are not allowed to see the person who is delivering the food to you. And quite often the dinner times are fixed, and they are fixed on the time of the destination country. And as we all know that our circadian rhythm, it has its own rhythms, and one is digestion. And quite often it's not the optimum time for pilots to eat, but that's the fixed time. And also quite often the food itself is pretty much fixed. If you have some allergies, you can tell them, and then those are of course avoided, but there is not much of a choice what you can actually eat there. You eat what you have, and you eat at that time when it's delivered. And the room lockdowns, they vary depending on the operational situation, how often the airline is flying to the destination. It might be just 12 hours, might be 1 day, but it might be also up to 3 to 4 days, which is quite long. And this really does affect on crew. One thing is, of course, fatigue, because when you're living in another time zone that you're used to it, everyone has their own ways of coping it, own ways of sleeping and doing exercise, going outside, and all of this is now suddenly changed. You just have to stay in the room. You might get quite lonely out there, especially if it's a longer quarantine, or then if, for example, the internet connections are not the best ones. So it might be hard to connect from the hotel room where you are. And also it might bring up the mental health issues, as Ansa was saying, that I think everybody will have and have had some effects on the COVID-19. And quite often there's also anxiety before the pairing, especially if it's long one. So to be honest, the crews are not actually bidding these pairings. So it's a bit of well, punishment is maybe a bit strong word, but it's not the most wanted pairing. So you might be a bit anxious before you go to the flight or to the pairing, because it's not that pleasant to be there. Of course, you don't know actually what is happening all the time. And then some countries then require also additional home quarantine after you have returned from the trip, even though that you have been there without seeing anybody. But still, it's interpreted as if you would have been some other country where then the national laws requires some lockdown. So some of the pilots may be quite long times isolated, either at the destination or then after return back home. Next slide, please. Well, what are then the potential solutions? Of course, if these regulations can be changed more towards the ICAO recommendations, that would be optimum. But basically, at least now, it's not possible at all the time. So we can try to cope with these regulations, and if it's possible, then the things that the destination hotel or the quarantine facility can provide would be the food service, so that you're not dependent on the times when the food is delivered, so that there would be a room service or then option to order food from outside. So that would be a good benefit for the pilots to a lockdown. Then also the proper internet access, because that's the way you can communicate. You can break down the loneliness and the isolation via communication. and that's one very big thing. If the quarantine is very big, very long, then sometimes if you have a bit more space around you, it might be beneficial also for your well-being, so that you don't have to be in one small room all the time. And of course, then if there is any possibility to have some walk or jogging outside, so that you can get out from the hotel room and then you can do a bit of exercise or walking. So that's also a thing that should be there. If you think of prisoners, they do have also daily walking time outside, but once you're locked down, then you don't even have this option. Then operators can also do some things. So, for example, the lockdown layovers, so they should be allocated evenly to the crew members. So I always say that the operators should distribute the misery evenly, so that everybody would get their share, but there wouldn't be some pilots who are on a row on these pairings, because that can be a bit too much to handle then if it's just continuing and continuing. Also then, if it's possible to have some volunteers for the longer layovers, that's always better if somebody's willing to go there than if you have to send someone over there. And then especially when pilots have their home quarantine after returning from the trips, then those should be somehow taken into consideration in the roster, so that in a month pilots should have a minimum off days that are really off days, that those are not the days that they have to stay in home quarantine. Then the next slide, please. Then also what the crews can do. They actually can do a lot to help this situation. So connect socially with others while you are in the lockdown, so you can connect with other crew members who are there as well. So we have had these like morning exercises, so that they are doing morning exercise at the same time via internet, or then evening exercises, 5 o'clock tea, evening check time. But anyways, that there are some times that if you are online, you can just go on and meet some other crew members who are there, and then you can share the experience that you have. Also, you can then go further. It doesn't have to be these crews. It can be all the crews who are at the time somewhere around the world. So you can have that kind of meetings as well. And of course, then to meet and have connection with the family members and friends at home. So that's one very important thing, but that requires the internet access and so that it's of a enough good quality. Then get active. So even though that the physical exercise might be a bit hard to do within a room, we know that it does improve a lot of your mental and other well-being itself. So there are many different kind of free apps that you can download, and you can just try some things that you have never done before. You can do different kind of stretching or yoga, or you can walk in your hands, whatever. But you can just do new things also, and a lot of good apps and programs are for free in the internet. Then relaxation, that also helps in controlling, for example, anxiety. So it could be breathing methods or meditation, and that also helps with the stress reactions that you might experience. Keep learning. If you learn new things, they usually also generate some kind of satisfaction and improve the well-being. So if you have any subjects to study or a new hobby that you are starting on and you need to know a bit more of it, so the lockdown or quarantine might be a very good place to do those ones. And also then you can think of all the things that you've kind of wanted to do. For example, many of us has a certain book that, well, this is the book that I have to read, but I never have had time to do it. So this is the place to do this kind of things, or you just start knitting or write a novel, take your guitar with you, and take this time as an opportunity to fulfill the things that you think that you'll be missing to do. And IFALP has also produced a safety bulletin on the room lockdown, and it gives these ideas for the crews how to handle that situation. Next slide, please. Then testing. So as Ansa said, it varies a lot, and it depends on the destination where we are flying to. Sometimes it depends also whether the flight is passenger flight or the cargo flight, if the crew is tested or not. But also it depends a bit on the operator, because quite often if the destination country requires the test, many operators and pilots feel that it's fair enough to take the test before the flight, because if you would have a positive test while at the destination, I think nobody wants to be abroad, be in a foreign culture, and being then subject to quarantine and isolation over there. So they rather test it before, so if they have the infection, they can just drop off the flight. And this is also in interest of the operators, because quite often it will then cause delays for the return flight if somebody from the crew is tested positive. So basically you always have 2 tests if the test is required at the destination. And then some of the countries also have the same test after return as the passengers. So basically you have 1 test at the airport, then 1 test 3 days after return, and some even 1 test after a week from the return. And this brings up pretty considerable number of tests that the crews are undergoing. So it might be up to 6 to 10 tests per month. And then you should always think whether it's really giving the information that you are required to get, or is it done just because of the regulation. Also, the testing and the other COVID-19 measures quite often then reduces the time spent in the hotel room and also the rest time. So it might be up to 4 hours from the landing of the flight when the crew is at the hotel room themselves. And that's quite often after a pretty long pairing, and at that time many of the crews would like to just sleep and get some recover for the flight back. And the next slide, please. Then what are the potential solutions? Well, basically the mutual recognition of the test. So if the test is done at the departure country, then the destination country would accept the result within, of course, certain framework. And also the rational use of tests. At some time we had some situation where crews were tested at the destination, and when they departed, the test result hadn't even come yet. So they were out of the country when the test results came, and there is no sense of taking that kind of test if you don't get the result and you don't do then anything with it. Next slide, please. And then the use of face masks is one thing that we've been also discussing quite a lot. And the current practices are quite diverse. Some operators require using the masks, some forbid them altogether while you are flying, and some leave the decision to the individual pilots. And the issue is a bit controversial, as the occupational safety and the flight safety issues, they might and quite often they do contradict each other. If the wearing of masks would not affect flight safety, then the issue would be very easy, just wear the mask. But as this is not the issue, then what IFALPA thinks is that there should be a proper risk assessment, which is weighing the occupational risks and the flight safety. And here you have to think of the transmission of COVID-19 in the cockpit. So what's the prevalence of the COVID-19 in that region, as well as what are the personal risks of complications for that crew member. And then if you use the masks in the cockpit, then what about the situation where you cannot use them, for example, drinking and eating? So if you use the mask for 8 hours and then you eat for half an hour, does that half an hour then just vanish all the potential benefits of the mask's use of 8 hours? And then the flight safety risks. So what's the effect of mask if you have, for example, rapid decompensation, so that you have to use supplemental oxygen? So can you breathe via the mask through the oxygen mask itself? Also, the masks, they do interfere with the communication. So you don't have the facial expressions, and also the non-verbal communication is diminished. You have to talk a bit slower and a bit louder when you are using the mask, so it might have effect also on the communication with the air traffic controller. And also then the disturbance of wearing the mask, and especially if you're having glasses, or then most of the pilots have to use sunglasses during the daytime. So there might be a bit of fogging. And of course, those are the things that are, especially in low visibility or in nighttime settings, it's not good to have anything that is obscuring the vision. Also, sense of smell might be diminished because of the masks, and then it might be increasing a bit of stress or fatigue itself. But also the risk assessment, when it's done, and if they end up to the position that, okay, masks can be used or they should be used, then there should be training of correct use of the masks, and also training of the emergency procedures with the masks if it's needed then. Also, we do have a lot of simulators and do have flights in the simulator, and there, as the flight safety is not directly involved. So if you crash a simulator, nobody dies. So there we would suggest that the masks are used, and also the air conditioning is a bit different within the simulator and then or compared to the real aircraft. Okay, then the next slide, please. So that's me. The left one is 2 years ago. That was before COVID. You can see the sun is shining, and I don't have a face mask. I weigh a bit more. And then another picture is a week ago in London, where I'm using the mask. My hair is a bit longer, and but one thing is common here. So it's the joy of flying, and that has remained. And this always reminds me of one seller in a marketplace. I think it was in Bangkok or in China. I was bargaining for some clothes, and he said that, yes, same but different. And the flying, it's same but different. It's exactly the joy of flying is still there, but it's a bit different to do the things. Next slide, please. Vaccination, and I think here we think very much the same as ICAO. So we think it should be voluntary, although it's very strongly recommended, and myself, I will definitely take the vaccine as soon as I get it. The vaccines, they need to be approved by the licensing authorities, health authorities. So that's one thing, because we have to think of the medical certificates that we are having. So therefore, I cannot go to another state and take a vaccine which is not approved by European health authorities. So that's one thing that you have to keep in mind. And we also call for the priority of vaccinations to aviation workers once the healthcare workers and other vulnerable groups have been protected. So this is basically the same recommendation as the new court recommendation number 18, which Ansa was referring to this. And then the next slide, and that's basically the last one. The key message is that we are very satisfied with the ICAO CAPSCA recommendations and have been also involved in their work. And we really would like to see that all the countries would then follow these recommendations. It would solve up pretty much of these problems that we are facing right now. And ICAO is doing a very good job, and we hope that this is going on and these recommendations will be enforced more widely within the near future. Of course, if the vaccination is good and we can lift up the restrictions that there are, that would be the best option. But I also think that we still have a, well, not very long way to go, but we do have quite a few kilometers to cover up. And the next and the last one, please. So that's it. Thank you. And all of our information and briefing leaflets can be found from our website as well. So if you want to download them, so they are there freely for use. Thank you.
Thank you very much, Dr. Tori. It's interesting to hear what you say. A little bit, I wouldn't say depressing, but all these measures, I guess the uncertainty for the crews and everything adds to the anxiety. But I'm very happy to hear that the joy of flying surpasses all these restrictions. Hopefully we can eventually lift some of them. So we are now going to move to our last speaker, Dr. Susan Northrup from the FAA in the US. Dr. Northrup, thank you for being with us, and the floor is yours.
Oh, it's my pleasure to be here. Good morning, good afternoon, good evening to all. In the interest of time, I'm going to move through these pretty quickly so we have a chance for questions and answers. Next slide, please. All right, so we're quickly going to talk about how the FAA responded for air traffic controllers and trying to keep the national airspace open and safe for all people. So we'll go real quickly through the goals, where we were at the beginning, and how we morphed into returning to full capacity at the end of the year, we hope. Next slide. So our goal from the very beginning was to protect our employees in the work site while maintaining the safety of the national airspace to meet critical national and public health needs. Next slide. So if we go back a year, as the virus began to be discovered and found and the disease manifested in the United States, at the very beginning in the US, we anticipated that the local public health systems would serve any public health needs. So when Midway Tower had its first cluster of cases, we quickly discovered that the public health system was overwhelmed and were unable to meet the needs that we had to move rapidly forward with our employees. So the Office of Aerospace Medicine assumed the public health role for all FAA employees and facilities. And unfortunately, at the time, with the usual staffing model we had and rapidly rotating shifts, and people were not in crews together, they all rotated, we ended up with a significant number of close contacts in both of these events, which we ended up having to send people home for self-isolation and quarantine for 14 days. The end result of all of that was Midway Tower in Chicago was closed for 8 days, ATC 0. And that led to some safety issues and some reroute, and the system itself worked fabulously to get around this. We've very quickly had to coordinate closely with the U.S. Centers for Disease Control and Prevention and other international organizations to be sure that we were doing things in a manner that we could accept traffic and send traffic on its way. We had an incredible drop in air traffic, just like everybody else did across the world. And early on ended up switching from passenger traffic to cargo so that we could get supplies moved across the country and across the globe. Next slide. So initially, with a decrease in air traffic, we were able to apply some of the basic risk mitigation strategies across the system. So within the FAA, anybody who could telework was sent home at maximum telework. For the people that had to work, like air traffic control and technical operations to support the air traffic control facility, we were able to go to hard crews so that people rotated together initially. Anybody that was at high risk for increased or worse symptoms from the infection, we were able to initially send home and use it with people that didn't have higher risk for negative outcomes from the disease. We also suspended all training. So in order to protect the operation, we got anybody who might bring the disease into the facility, out of the facility, and we limited who came in. Next slide. So once we minimize the number of people in the facilities that might actually catch or spread the disease, we began to look at what we could do in the way of occupational public health measures. So the Air Traffic Organization was all in. We did social distancing, we provided masks, we modified the workplace to the greatest extent possible. We tried to keep people 6 feet apart, and if we couldn't keep them 6 feet apart, we limited the exposure that they had with someone else to the greatest extent possible. We instituted what's called a wipe in, wipe out. It was voluntary and still is voluntary, but we provided the cleaning supplies so that if an air traffic controller or a tech ops person was concerned, and we encouraged this actually, that they could clean the area they were working with, particularly the common touch surfaces, and then we asked that before they got up, they cleaned it again. Finally, within air traffic, we encouraged people with pending tests for any reason, close contacts of known cases, and sick people to stay home. And that was a pretty large paradigm shift, because a lot of people, oh, it's just the sniffles, it's just the allergies, it's just, oh, my stomach's a little upset. But in the environment of COVID, it might be COVID. And then we had people coming to work sick, and that would necessitate contact tracing. And ultimately, if they were in the facility ill, we had to do a level 3 cleaning, which is an enhanced cleaning with disinfection, which led to several ATC zeros. I remember some nights where we had 4 different centers in that evening closed ATC 0 for a period of time while the facility was cleaned. Across the FAA, we've utilized excused absences. So if someone is ill, they use sick leave, but if they're exposed to someone in the course of doing their job, we would send them home on excused absence. We did all of our own contact tracing to be sure we were capturing who might have been exposed to stop the disease process. We got very involved in international and industry outreach through the CART and CAPSCA, and we published safety alerts for operators, or SAFOs, that gave the operators and the airports, here's what we think you should do. We use special federal aviation regulations, or SFARs, to publish alleviations. For instance, in the early parts of the event, we extended the validity of the medical certificates for 90 days. Did not go past 90 days for anyone. And then they did the same thing with training. All right, next slide, please. So testing and vaccination. We do not currently in the United States use testing to make a return to work determination. We had initially, the CDC had 2 different arms to return following an infection. One was to be symptom-free for a period of time and so many days after the onset of symptoms, or you could do 2 negative tests. Well, as we discovered, the PCR test in particular can have a false positive. Well, it's not really a false positive. It's picking up pieces of the virus instead of the whole virus for up to 90 days. And we had to work through that. As far as vaccinations, we have 3 vaccinations currently approved in the United States under emergency use authorization from the Federal Food and Drug Administration. That's the Pfizer, the Moderna, and the Johnson & Johnson vaccine. We are currently encouraging people to get vaccinated. Our critical infrastructure people are in what we call Tier 1C, or 1 Charlie, which is analogous to the WHO 3. We are working to identify all of the critical infrastructure people and give them letters. We are trying to get some allocations of the vaccine itself. We do have a grounding period following vaccination in the United States for air traffic controllers and airmen, and that's 48 hours after each vaccine. And of course, 14 CFR 6153, which is one of our Code of Federal Regulations that specifies if you have reason to believe you may not be able to safely operate in the national airspace, you should ground yourself. Within the United States, we've got over 21 million people with the first dose. We do have a couple of facilities that are approaching 70–80% vaccinated. We've had several municipalities reach out to us if they had vaccines that were about to expire, and can we help with your air traffic controllers? And that's been successful in certain areas. Next slide, please. All right, so return to full capacity. Some of the things we've learned over the last year is how do we go about bringing people safely in? So as the traffic came back up, we needed more people. But what we bought with sending folks home in the low traffic pattern is the engineering administrative controls that we could put in place that would protect people as we brought more folks back into the facility. So we initially started bringing back the partially trained air traffic controllers. So they weren't fully checked out, but they were checked out on certain stations. And we brought them back up to speed through training that we tried to maintain a 6-foot distance by separating monitors for the training program. But the reality of the matter is there's a certain amount of over the shoulder. So we tried to make sure we had the right face coverings in place and all the cleaning supplies. Slowly, we've had to bring the increased risk folks back. Again, we have the engineering and administrative controls in place to limit the potential spread. As far as bringing new people in for training, we're using a gating criteria that's designed to protect the core of the operation. So when the disease in the local community drops to a certain level, we begin to bring people back in. And then we watch very closely the disease burden in the local community or county and the number of cases we see in the facilities. And we turn that on or off based on the local environment. Another really important thing that we have determined in our larger facilities, rather than wait to do a level 3 or enhanced cleaning, which is now an emergency after you have an ill person in the facility, we do a level 3 or enhanced cleaning on a daily basis in these facilities, such that if someone becomes ill, we've probably already cleaned it and we no longer need to interrupt the national airspace. And as we get further along, we're beginning to look at special events. For instance, Sun and Fun and Oshkosh Air Adventure. There is a real drive. People are getting tired of all the restrictions of COVID and putting our lives on hold. So we're looking at how we might be able to support one of these or more of these large fly-ins, and how we would make sure that the air traffic controllers are healthy, uninfected before they leave their home. And then once they're at the event, at the end, how do we make sure that they didn't acquire the disease and take it back to their home station? So that's some of the things that we're grappling with right this moment. Next slide, please. I believe that's the last one. Yes. So Jean-Francois?
Thank you very much, Susan, for the presentation. It's interesting because some of the measures you mentioned are very familiar. We use some of them in my workplace as well. So we have now finished with our three presenters. Mindful of the time, we only have roughly 15 minutes for question. I would like to start by asking the first question we received from the audience to Dr. Ansa Jordan. We have received a question asking, what about the health passport? Is there any plans, maybe from ICAO, from CAPSCA, to be considered as a mandatory condition for the flight crew? So the requirement for passports towards flight crews. Dr. Jordan, if you have an answer to that.
Thank you, Jean-Francois. This is a very interesting question and a hotly debated one within ICAO on health passports. So for crews specifically, in the takeoff guidance document, we have a crew status card where crew can complete whether they have symptoms, whether they have been tested, and whether they have been vaccinated. And that is really to inform their employers, but also it could be submitted should they be asked at the point of entry. In terms of health passports, we tend to steer away from that term, and that's largely because of the current WHO guidance that do not support an immunity passport. So if you get a health passport, the next step of thinking is, okay, then you might be immune, and they start calling it an immune passport. And the evidence so far is if you have had an infection, you could be immune for a short period of time. We're looking at probably 6 months, but not necessarily everybody. There's difference in the reaction of building antibodies. So we really think it's premature to implement a health passport or an immune passport. But on the other hand, we need to know whether someone has been tested or has been vaccinated, because that could help in, especially for crew, in reducing these requirements for exempting them from additional testing or exempting them from quarantine, for example, during layovers. So I hope that answers the question.
Yeah, I think you said the right thing. You know, we're stuck between a rock and a hard place. We have on one side, we would like to accelerate the procedures, but on the other side, we don't have the answers yet on the immunity of those vaccines. Thank you. I would like to ask a question to Dr. Torrey now that we received regarding the use of face masks. You covered it a little bit already, but the question is about the use in the cockpit, whether when the door is closed, some operators require it to be worn all the time during the whole flight. If you want to talk a little bit about it, if you have some of your insight, please.
It really depends on the operator, and I know some of the examples. For example, in Japan, they use the masks, but what I've heard is that it's not mandatory, but it's more of their culture as well, because in Asia, people have used the masks before much more than in Western countries. In our airlines, it's basically it's not forbidden, but it's not, well, actually they are not saying anything. They just say that if a mask wearing induces some kind of risks of conducting the flight, then do remove the mask. And we have done a safe assessment. And for example, if you need to use the oxygen masks, the oxygen flow will go through the mask itself. So that's not the problem. The biggest problem probably is that whether the oxygen mask is not leaking, because if you have something in between, so there might be a bit of holes where the oxygen can flow out. But basically, we've come to the conclusion that it's safe if the pilot himself feels that it doesn't interrupt the safe performance of duties. then some countries do forbid it. I think it was in Canada or US, some of the carriers say that no, you are not allowed to use the mask. And for example, EASA does not recommend using the masks while flying. I think other recommendations do not take firm stand whether it's used or not. Basically, they say that you have to use it at least until the cockpit door is closed once you are by yourselves. But it really varies a lot from country to country and also from operator to operator.
Thank you very much. Yeah, I was wondering in the case of a rapid depressurization if it would be appropriate or not, but I think you covered the point very well. Thank you. I have a question regarding air traffic control, so that would be for Dr. Northrup. From a health and safety perspective, has there been any safety risk assessment performed on air traffic controllers wearing PPE, so personal protection equipment like masks, while working at the position? The question is more related to when speaking to pilots on the frequency, any issues with hear back, read back, the readability of the phraseology, if you have any information on that.
So we hear anecdotal issues associated with that, but we did study N95 masks and other face coverings in several of our facilities, and they did not show significant degradation in communication.
Thank you. I have another question, maybe for for Dr. Tuori, sorry, regarding, you talked a lot about the feeling that the crews were experiencing when they were locked down in their rooms. So has there been a plan devised to address all these many pressures, the stretches of flight hours and duty time, crew fatigue, perhaps underreporting of health and safety issues that could likely be extended on the commercial aviation system once the international restrictions are lifted? Because we know, that at some point there will be a restart. We're not sure how fast and how brutal, if I may say, it will be. How do you see these all these restrictions playing for the flight crews?
Well, we do know that they do have effect, and for example, IFAL has put out safety bulletins on, for example, the extended duties due to COVID. That's not exactly the same thing that once you're locked down, but at those times we did have very long flight times, so they were up to 24 hours. Of course, there were augmented crew, but we do hope that these are taken into the consideration. But I think everything should be based a bit on science, and we really don't have much data on this. What is actually happening? What is the fatigue level or the alertness of the pilots if they are in lockdown compared to the normal layover? So we are a bit of lacking data. So we are then basing these assumptions to the experiences that we have, but really I haven't come across to any studies, for example, where they would be doing some fatigue issues. That would be one thing to do. Just compare the cruise to the destination where it's locked down and where it's not, and then see whether there is any differences, for example, in fatigue or alertness.
Thank you very much. I have, we'll take maybe one or two more. We still have a few minutes. I have a question for Dr. Jordan. Sorry, I thought you were talking. The question is, will ICAO be reviewing or updating the health and safety requirements in the future, let's say, beyond what we're doing now? So after the impact of COVID-19, I guess the question is more how ICAO plans to potentially prepare for the future.
So yes, ICAO is currently reviewing Annex 9, which is all about facilitation, which talks about testing, quarantine, vaccination, disinfection. So that is at the moment being reviewed, applying the lessons learned from COVID-19 in terms of the standards and the recommendations. On the other side, CAPSCA is continuing, and the problem we have is that one infection could be very different from another. So we had Ebola, which is a total different type of infection. So the ICAO requirement should be wide enough to build resilience to all of these types of infection, but CAPSCA will then provide more detailed for that specific infection going on. But I think ICAO has learned a lot of lessons on this, building resilience and going forward and really making use of this bad situation and looking at more innovative solutions like the rest of the industry is doing with contactless processing and for example. So yes, we are definitely learning lessons and applying it.
Thank you very much. I'll address a last question to Susan, Dr. Northrop, related to air traffic control. We've been asked, is it true that the FAA demands 48 hours unfit for control after the vaccination?
That is a true statement. However, within the FAA, they're given excused absence, so they're not charged sick leave.
Okay. Thank you very much.
And essentially what we do is we look at the emergency use authorizations and look at what the side effect profile is, and then set the time frame based on that.
So you would mean that it could be different from one vaccine to another?
Correct.
Thank you very much. So we've passed the time of the end of the webinar, but we had very good questions from the audience, so I wanted to take as much as I could. I would like to conclude by thanking our three experts today who accepted to share with us their knowledge and their perspective, and to take some time to answer our participants' questions today. I've learned quite a lot myself, and I hope our participants did too. So now, in light of what has been said, and after a little more than a year through this pandemic, it's obviously evident that COVID-19 has impacted the ability of operational staff to operate normally, and for those who have been away to return to the normal working environment. In what we can call this new normal, COVID-19 related health measures, as we have seen, have had a significant impact on the way we're conducting our day-to-day operations, whether it is flight dispatch, air traffic controllers, flight crews, and other aviation professionals. There's still several unknowns. Even after the webinar today, there's still a lot of uncertainty when it comes to possible long-term effects of the pandemic on our working environment. And my personal point of view is that managing these variables with additional complexities related to crew testing, potential future health requirements will definitely present new challenges. We really hope that during this webinar, you were able to find some answers to several of these issues, and that our experts have enabled the creation of an open dialogue with regards to possible mitigation measures in your individual workplace, and that you'll have some sort of takeaway item. So once again, I would like to thank our experts. I would like to take a second to thank Helen Parker and her colleagues from CANSO for providing the platform and the required expertise we needed to run this webinar today. Ruby Syed and her team at IATA for coordinating the preparation of today's event. And last but not least, of course, I would like to thank all of you, our participants today, for being with us and for engaging in the session with our experts. We hope you enjoyed this webinar, and we really hope to see you again in our future iterations. On this, thank you very much. Stay safe and take care. Over to you, Ellen.
Thank you, Jean-Francois. Thank you, Ruby, and all our speakers today. And thank you, everyone, for attending. Before we finish today, I'd like to advise you that episode 2 of the series, Maintaining Competency and Training for ATCO's Dispatchers, will be held on Thursday, the 22nd of April, 2021 at 12:30 CEST. So we will provide the registration link in the email that we'll send out after this webinar, and we'll send it out including the link to the video. Once you leave today's webinar, you will receive a survey and would appreciate if you could complete that and provide your feedback. On behalf of Canso, IATA, IFALPA and IFATCA, thank you for joining us today and enjoy the rest of your day.